ankle injury is quite a prominent trail running injury. So how we would approach that is we would send the patient for x-rays or something of a therapist, and they would see the grade of the injury. Then we would put them on a return to running protocol with our therapist. That would normally be about a 4-week recovery. And then what we have to teach that ankle again, the proprioception in the ankle, to be able to sustain or read the type of surface so that they can return to trail running again. That would normally take about 4 to 6 weeks, and then the body would be able to deal with the pain. If we have anything like chronic pain, we would always refer them to our therapist. We work with biokineticists, but we believe that you have to move to get rid of pain.
So what I hear from you is that there's a common belief out there that if people's got an injury, say for instance I twist my ankle, that I'm not allowed to train for 6 weeks till it's better. And then people's fitness will get behind, they will start getting unfit again, and then they actually have to restart. But if I listen carefully to you, you actually keep the people moving in that time, but in a safe environment, so that they don't lose fitness, they don't lose this enthusiasm, and they can just get up back on the road once the injury has been healed.
I actually have a very good example of a client who recently sprained her ankle. Just before that she was doing 100 k's a week, and we have a big event coming up in 3 weeks time from now. So she was unable to run, but we have a very cool environment like you just said. We put people in a pool and they do all their running in a pool. We call it aqua jogging. And she was able to train 6 days a week or 7 days a week. She actually puts through for 4 weeks in a pool because you don't fatigue your body, it's just you train your heart. And she was so fit that getting out of the pool she could go straight into 60 k's weeks again, and she's back on 100k weeks.
I think the challenge will be for them to start moving around the spectrum. So sometimes people in acute pain needs to take it a bit easier with acute injury. They need that time for recovery, they can't push themselves. Where the people that are risk takers would have acute injury, will just push themselves and they might injure themselves more. And then we always have the danger of acute pain going over into chronic pain. And then your people that are scared of your inhibition system, that are scared of pain, they probably need to be pushed more. I think the important part is to get a diagnosis, to know what is the origin of your pain, and that we do at the pain clinic. We try to get a reason or answer where this pain is coming from. Is there an acute injury? We sit with the patients, we talk with them, we see their history up to there, where they come from. If there's acute injury, we know this is the reason for pain, and we start with rehabilitation that you guys are so well with doing with. If it's a chronic pain, then there's a whole team that we need to get on board. And most of the time, the people with chronic pain, we need to educate. Lots and lots of education, sitting with them, explaining to them where chronic pain comes from.